My name is Sister Charity Mugwa. I'm a registered community health nurse working in Bula Mission Dispensary in Taita District. We usually see many patients. One of the conditions that we see is tuberculosis. For us to diagnose the case of tuberculosis, these patients, they have so many signs and symptoms that they come with. For tuberculosis, it is a condition whereby a patient comes coughing, and when we do the test for sputum, they are positive. Though they are patients who usually come coughing, but when you do the sputum, you get that this patient, the sputum is negative. So we have to send the patient to be done chest x-ray, whereby the chest x-ray will show the tuberculosis in the lungs. After we diagnose the patient has tuberculosis, the patient is immediately started on treatment, whereby there are two phases of treatment for the tuberculosis. The first phase, the patient usually takes drugs daily for 2 months, that is 60 days. That is, we call it intensive phase. And then after that, we repeat the sputum, whereby if in case the sputum is positive again, the patient has to repeat the phase which is the intensive phase. But if it is negative, the patient go to another phase whereby another treatment is started for 4 months, a total of 6 months. After the completion of the treatment, the patient is again done the test for sputum. If the patient's sputum is positive again, the patient has to start again the treatment. But if it is negative, we declare that the patient, the treatment has been well and the patient is now treated well. You get that some of the patients, they default the drugs. Mm-hmm. And for those who default and the tuberculosis recur, they are given a different treatment, whereby the first phase, this patient is given injection, daily injection for 60 days. And then the patient continues with other drugs for the continuation phase. You get that there are other patients who do not default the drugs, but later, this patient, there is recurring of tuberculosis. It goes the same case. This patient will be started again with injection for 60 days, and he continue with the other drugs after finishing the injection for tuberculosis.
So what is the medication that you give them? What is the drug that's used?
We give them LHEZDA, which is rifampicin, ethambutol, isoniazid, and then I continue with LH, which is rifampicin and ethambutol.
Perfect.
Yes.
Okay, and then Sister, you said that frequently a patient who has tuberculosis is also HIV positive.
Yeah, you get that majority of the patients that has tuberculosis, out of 100% you get 90% they are HIV positive.
Wow.
But you get that there are others who have who have tuberculosis, but they are HIV negative.
Right.
This is because you get that when person is HIV positive, the immunity is low.
Right.
So this patient will get most of the opportunistic infections, tuberculosis being one of them.
Right.
Yes.
So is there a large percentage of people who are carrying the tuberculosis infection in the area, or not so much?
It is not so much.
Okay.
Yes.
Okay. Thank you.
Thank you too.